No, facing that way.
Yeah. So we're gonna have your arms up, okay? And we'll see how far back you can go, because we can look at the total arc of external rotation, right? And he's a little hypermobile on that side. This looks pretty normal. Now try it all the way down. Oh, you're lacking. Okay, right? Because ideally we want to be closer to that 80 or 90 degrees. But what we're going to look for is their difference in the total arc of motion. No, right? He was pretty symmetrical. Because, right, if it's like a 20, 25 degree difference in the total arc, that's going to be a positive test. But if you're here, right, in the neutral position, and come down, and if we get our goniometer out, which you can, right, we're maybe 25, maybe 30 degrees of internal rotation, right, if this is neutral. So this is a positive test for him, right, because he has 25 degrees, okay? All right, so he's gonna be at a 2-time increased risk of injury in his shoulders if we don't get his internal rotation better. So then we can make that into a mobilization. You can do, obviously, just do generally posterior glides at the glenohumeral joint, right, which is just a general joint mobilization. We can have him lay on his side and do sleeper stretch as an intervention. We can give him that strap for internal reach behind the back stretch. You can also do a horizontal adduction stretch to stretch the posterior capsule. But if we're gonna do a mobilization with movement, let's get you down here. I like to use like a little small bolster, or you could even use like a calf foam roll or towels to put him in a bit more of that open packed position. Right, because if he's down here, we could be putting a little more stress on some of the anterior structures, like his bicep and things like that. It might not be as comfortable. So we just kind of prop him up there. And it's pretty simple, right? I like to distract the joint, okay? And then you're gonna put your hand, just like you do normal glenohumeral posterior glides, right on his humeral head, posterior glide, and internally rotate him, right? Assess for pain. A little slight discomfort is okay, okay? He can get pretty far down in this position, very normal, even without me pushing on him. But then you can change the angle too and get him closer to that 90 degrees of abduction, right? Think of like my hand is perpendicular and I'm not here, right? Because I'm gonna give that force, and that's where he gets a little bit tight, okay? And we can just do some passive range of motion, shoulder internal rotation with posterior glide at the glenohumeral joint.